the AidPlan Program. With this program, we have a clear focus on treating all kinds of complaints and making the multitude of symptoms disappear or not even arise in the first place. Without medication, but also without a promise of miraculous healing, we offer you a solution with which you can bring your symptoms and pain under control in the long term, with the aim of complete healing. To do this, we rely on the latest and most far-reaching findings and on a therapy that has been tried and tested in the US and Europe for 15 years, which has precisely this holistic approach. Thousands of therapists have already specialized in it, but still too few for everyone to have access to it. Since the treatment is complex and interdisciplinary, it takes a lot of specialist knowledge and extensive practical experience with patients to understand what really helps. Few therapists devote all of their attention to this one topic because it is a relatively specialized area. However, their numbers are growing. At AidPlan, we have brought this knowledge online, summarized it, and explained everything on the topic to you from A to Z. We also give you step-by-step instructions that show you a practical path towards self-treatment. In order to understand why this program is so unique and promises one of the greatest chances of success, one must also understand why it is so difficult in classical medicine to bring the symptoms under control. Our program is essentially based on the assumption that your symptoms are caused by myofascial adhesions, sticky muscle and connective tissue that causes pain in the nerve tracts and is triggered by shortened muscles in and around the pelvic area. There are many reasons that these adhesions arise, for example, muscle tissue sticking together due to constant incorrect posture or longer periods of sitting. Once the muscle tissue is stuck together, which, by the way, cannot be clearly seen on X-rays, the nerves it contains are in a constant state of alarm and cause you discomfort and pain. In other words, your nervous system is so irritated by muscle adhesions and tension that a kind of disorder has occurred that causes pain in areas that normally do not cause pain in healthy people. But it doesn't always have to be a pain. Sometimes it's just a constant pressure on the bladder that makes you feel like you have to go to the restroom all the time. And this is where the difficulty arises. While a physician or medical professional often only treats a sub-area, we have to concentrate on two specialist areas at the same time for long-term success. On the one hand, we have to loosen these myofascial adhesions, which have often formed over months and are located in deep-seated areas. These bonds do not come off automatically. It requires a lot of patience, persistence, and a sure instinct. At the same time, we have to address your nervous system. So we have to teach your body to once again be able to be pain-free and to stop sending out atypical stimuli. Only if these two essential challenges are met successfully will you have the opportunity to control and to combat all of your symptoms. Building on this, we then also have to ensure that the symptoms do not recur and that your body does not fall back into old patterns. Sounds easy, but the method will only work if used correctly and both issues are addressed simultaneously. If only purely physical causes are treated, your nervous system will constantly ensure that new adhesions and tensions arise in the muscle tissue. If, on the other hand, only your nervous system is under control, the nerves will continue to send pain stimuli through sticky muscle tissue and your nervous system will become restless again. So you see, we have a lot to do and it will demand a lot of discipline. But believe me, it will be worth it. Just imagine what it would be like to be able to live without your symptoms. No more pain or discomfort in the sensitive pelvic floor and genital area. No pain when sitting or walking. No more excessive urination. And of course, a healthy pelvic floor also ensures a fulfilling sex life. With AidPlan, and thanks to the possibilities that the Internet offers today, we have created an all-encompassing program. So when you're ready, let's get started.